So, a little over 3 years ago, I decided to remove my breast implants. I went through an explant and capsulectomy procedure after having implants for 12 years. And I know that somebody shared their story about what happened to them, and that's what helped me connect the dots and come to the conclusion that my breast implants were slowly killing me. So I decided to do this because since that procedure happened 3 years ago, I've had at least a handful of women reach out to me and ask me a ton of questions and tell me that they identified with my story and that they decided to also remove their breast implants because of what I shared. And that opened up a world of knowledge that they had no idea about. So if this helps just another handful of women, or even one, to me, it's worth it. At the age of 23, I decided to get breast implants. Very popular back then. I think they still are, to be honest with you, but I think now there's a little more awareness as to what can happen later down the road with implants. So at the age of 23, I decided to get breast implants. After a recommendation from a friend who had already done hers, I went ahead and picked the doctor, chose a date, and jumped headfirst into this new venture. And I did saline implants, 350 cc's underneath the muscle. That was the customary way of doing it, because underneath the muscle, if you have a child later on, then you can still breastfeed. Well, everything was fine for the first 6 years. 6 years in, I suffered a rupture on my right implant, and I had to have a second surgery to remove both implants and replace them. I went back to the same doctor who did my original surgery. He was excellent, but he did recommend that I go a little bigger and that I do silicone. When I did my first surgery, silicone was not currently in use. It was banned. So now they were back in business and he recommended silicone implants, and that's what I went with. Fast forward a few years and I have experienced by then a few health complications, food allergies, digestive issues, gut issues, rashes, unexplained rashes that nobody had any explanation for. And it happened about 3 or 4 times until I finally found this dermatologist, I'll never forget him, Dr. Mendez, who was very thorough. Not only did he do blood work, but he also did a biopsy on my skin. I had a rash on the lower extremities. So it was basically from my upper thighs all the way down to my ankles, covered in the most horrific looking, inexplicable spots and, marks that just, it would happen. They would be out. The breakout would last anywhere from 1 to 2 weeks, and then it would just disappear, and it wouldn't happen for months. And every time I went to a doctor, they had no explanation for it. Oh, it's stress. You're stressed. That's what it is. Because everything is chalked up to stress after you're 30. Or you ate something, or maybe it was a reaction to a medication you were taking, which I really don't take much medication because I've always been very healthy, thankfully. So finally, Dr. Mendez decided to look into my rash, and after extensive blood work and the biopsy came back, I went back to see Dr. Mendez, and he tells me that my ANA panel came back positive for an autoimmune illness. Imagine my surprise and shock, and I went there by myself. I wasn't expecting that kind of news, and I leave there thinking that my life has been turned upside down. So I had a ton of questions. So what I did was I started doing my own research as to what autoimmune illnesses are, why they occur, and if there is a way to undo them or fix them or treat them. There is no cure for an autoimmune illness. Once you have it, you're pretty much managing it the rest of your life. And what he suspected I had was lupus, which is something that you live for the rest of your life. When I found out what the possibilities of someone who lives with lupus are, I got really down, because one of the major things was infertility, and that's something that to me is precious. I don't have children. I didn't have children at the time. So I realized that this was a serious illness. Well, Dr. Mendez referred me to a rheumatologist who deals with these kinds of illnesses. This rheumatologist did further testing about 1 or 2 months after my encounter with Dr. Mendez. And miraculously, this round of blood work came back fine. Everything was clean. There was no signs of any kind of autoimmune illness. But she did say that we had to keep monitoring it, because the fact that at one point there was something there, it doesn't mean that, and that now it came back clean, that didn't mean that I was completely out of the woods. So the safest thing would be, and the smartest thing would be, to continue monitoring it to see if there's any changes down the line. 3 months later, we tested again, and I was fine. 3 or 6 months later. Fast forward a few months after that, I'd say this was at the end of 2016. It was October of 2016, actually. I remember the date because it was right around my birthday. I read a Facebook post from someone I went to high school with who shared her experience on breast implant illness. She also linked to the page, the Facebook page about breast implant illness, which is a community of tens of thousands, probably hundreds of thousands of women by now, who have all dealt with breast implant illness to some extent. Some have even died. So this is a very serious illness, and it's not something that is talked about much in the medical industry. I read her post, I reached out to her, and we talked that night, and we talked for about 4 hours. I had so many questions. She was so open about it all, and I compared a lot of her symptoms and her experiences to mine. So at that moment, I knew that I had to remove my implants. So I started putting in motion everything else that comes after that. What doctor? When can I do this? Can I afford it? How much is it? So many questions. And it was very expensive. I decided to use the same doctor that she used. She highly recommended him. And I valued her opinion. She was so well informed, and she had done her research, and I did look up the doctor myself and saw, his practice and the reviews and the things that were said about him. And I'm very happy that I chose him, because the staff was amazing. He was amazing. The experience was very comforting. Exactly what you would expect in a situation like that. So April of 2018, I went through with the explant, and it wasn't as bad as I expected. I recovered pretty well. I usually do. I usually do recover pretty well, thankfully. But after surgery, there is a whole other battle that you're dealing with, because when you decide to get breast implants, you do it for aesthetic purposes. And going 12 years with a certain look, and then basically undoing that overnight, that is a whole other psychological battle that I was not ready for. And as stupid and trivial and insignificant as it sounds, any woman in their mid-30s that has to go through this will definitely experience a little sadness, a little depression, a little anxiety, insecurity, mostly. 100% insecurity. And, you just have to convince yourself that your health is more important than anything else. But I don't think you're ever really convinced. You just try to compartmentalize it, or at least I did. and move forward, because nothing else mattered but your health. I'm going to go over the list of some of the symptoms that I felt, and also some of the symptoms that are common among most of the ladies that have experienced this. I experienced a lot of fatigue. I couldn't stay awake throughout the day without falling asleep or just feeling extremely tired all the time. Brain fog, memory loss, a lot of it. I think I always had pretty good memory, and when I started forgetting things, I felt powerless. I felt, I don't know, it was a horrible feeling. Joint pain for me was the worst symptom. I didn't say this to anybody while it was happening until I realized what the problem was, but I would cry myself to sleep at night from the joint pain I felt in my elbow, in my arms, and my shoulder. And it was so debilitating that ibuprofen 800 wouldn't even do anything to me. But I knew something was wrong. I knew that wasn't normal, but the joint pain was very severe for me. Hair loss, I don't particularly remember any significant hair loss to where it might be worrisome, but I've always had hair loss in a significant amount, so to me that wasn't any different. Skin itching and various rashes, and weight problems, which I had significant weight gain that I couldn't account for because my level of activity had not changed, and it wasn't as easy to get the weight off as it used to be. And here's something that goes very overlooked by many people, not just women with breast implant illness, but anybody with gut issues. So breast implant illness leads to gut issues, which leads to a host of other things in your body. And one of those is inflammation. After having my explant surgery, I compared photos from the day before surgery or the morning of surgery to just a few days after, and the change in my face was pretty obvious. The puffiness was gone. I just looked and felt different. Insomnia and poor sleep is another symptom. I suffered from insomnia mostly because of the joint pain that kept me awake most of the night. Dry eyes and decline in vision. Hypothyroid. Hypothyroid is one of the other things I forgot to mention. When Dr. Mendez did the extensive blood work that determined that I had an autoimmune illness, one of the things that came up was hypothyroidism. And my thyroid has been fine ever since. I have kept monitoring this since then. Not every 6 months, maybe every year with my annual checkups, but I haven't had any red flags raised again. But that's another symptom of breast implant illness. Adrenal fatigue, diminishing hormones, early menopause, low libido. These are all symptoms that come along with this illness. It basically takes over your life. Nothing feels the same. Nothing sounds the same to you. You might lose interest in certain things just because you're not feeling it. You should pay attention to your symptoms. Pay attention to your body. If anything changes, there's a reason for it. It's just not just age. You don't age like that overnight. It's your body trying to tell you that something's wrong. So some of the other symptoms that I don't particularly identify with were slow recovery after exercise, vertigo, nausea or gastritis, fevers I didn't have, persistent bacterial and viral infections, thankfully no, UTI infections and constant yeast infections, not my issue. But here are some of the ones that I'm still dealing with, which is reflux and GERD, which is gut issues. And irritable bowel syndrome is another common one. Throat clearing, coughing, difficulty swallowing, and lots of headaches. I did suffer from a lot of headaches. So these are symptoms this is why this illness kind of sneaks up on you, because these are things that can happen to anybody on a random day for no reason at all, and you just brush it off as maybe I didn't drink coffee and I got a headache, or maybe I, ate something that didn't sit well. When you start documenting everything that's happening and with the consistency that it's happening, you start to realize that it's not just something that you can overlook and move on with your life, you start realizing that it's something, these are dots that you need to connect to get to an endpoint. And when I realized that breast implant illness was a thing, and I started doing my research and I started looking back at my medical history, I started connecting the dots, and it all hit me. And that's why I determined that I needed to remove my implants. It's a decision that you have to come to on your own, because no doctor, no medical professional, and definitely no plastic surgeon is going to tell you that these bags, well, there's no bags in here now, but those toxic bags are slowly killing you or debilitating you or diminishing your health. You have to know your body and you have to follow your instinct. So now let's fast forward to a happier version of this story, and fast forward to 2021. I decided to do a reconstruction surgery to add fullness and volume to my breasts. So the recommended procedure for this type of patient is a fat transfer. So I did a 360 lipo all around, and I had the fat transferred to my breast. So it's natural. They feel natural. They look natural. They're not as big, and there won't be, the risks are not the same, not nearly the same as obviously a breast implant that is coated in silicone. So earlier this year, I went to Evolution MD and decided to follow through with the consultation that I had done years ago after explanting. I went to see Dr. Zayas, had my consult with him, and I chose the date and went forward with it. I was nervous and excited and probably a little ignorant because I didn't really know what this entailed. I wasn't 100% educated on what I was getting myself into, but here I am 6 weeks later, no regrets. But here's what I experienced. Day of surgery, I arrived about 9 a.m., did my paperwork, had my COVID test done, and then I went in for pre-op photos. I got marked up, and then I went into surgery. About 3 hours later, maybe 2 to 3 hours later, I was done. And when I woke up, I was in pain. It wasn't really that much pain. I think I have a pretty high tolerance for pain. I do. I didn't really take pain medication for more than 2 or 3 days. But it's a very uncomfortable procedure. Liposuction is not something to mess around with. It is uncomfortable. So if you decide to do this, just be prepared with everything that you possibly can. All the comfort and medications and, healing tips that you need them all. Just try them all because it will help. So the day of surgery, I was out and I was home by 3 or 4 in the afternoon. Came home. I was a bleeding mess, I'm not going to lie. It was a bit shocking the first day, but every day after that, it got a lot better. The day after surgery, you have to start with the lymphatic drainage massages, which are extremely painful, as you can imagine. I had somebody come to my house. The recommended amount of massages was 10. I did about 14. So I did 2 weeks worth of massages from the day after surgery up until 14 were complete. And every day it got progressively better. And it gets to a point where you actually need the massage and you want it because your skin feels so itchy and unsettled that the massage is actually really soothing. Painful, but soothing. It's kind of weird, but you'll understand if and when you go through it. So after the massages, the other things that you have to make sure you wear the compression garment every day, at least for the first month, every day, all day, except for when you shower. You wear it to sleep, you wear it out and about throughout the day, and you only take it off to shower. After 4 weeks, my doctor recommended that I don't have to wear it to sleep, That's up to you if you want to wear it out and about during the day or while you're home and sleeping. So here I am, 3 years post explant, 6 weeks post fat transfer, and I finished with my massages about 2-3 weeks ago. I feel great. I feel healthier than ever. I'm at a lighter weight. I can manage my weight now. One thing very important that I forgot to mention is when I woke up from my explant surgery after removing the breast implants with the encapsulation around the breast implant, I could breathe. So I can breathe better than ever before. I didn't realize how much weight there was on my lungs from the implants until I woke up from surgery that day. So I'm just so thankful for that person that shared her story so that I could learn about this and give myself a chance to live a healthier, longer life, and that I can share this with other women and hopefully save their lives too. I have no regrets. I'm happy, I'm healthy, and I'm extremely thankful. Thank you for tuning in and listening to my story. If any of you have any questions, concerns, or you just need to talk about this, please reach out to me. You can contact me via Instagram, email, phone number. All my contact info is on my Instagram page, HanelPina_realtor. I'm here for you. Also, make sure to stay tuned and subscribe to my YouTube channel because there's a lot of great content coming up